So understanding your Medicare options 2025. The 2025 part, that's really specific because every year there are changes to Medicare. For the most part, it's usually just the Medicare Part B premium changes and the Medicare Part B deductible changes. For the most part, everything stays pretty consistent. In the last couple of years, there's now a cap on pharmaceutical drugs at $2,000. It was $8,000. So now the cap on prescription drugs, $2,000, and then the insurance company has to pay 100% beyond that. Good and bad to that. That affects about 4% of the population. So 4% of the population really benefited from that new $2,000 cap. Unfortunately, 96% of the population did not benefit from that because insurance companies, whenever they have to take money from one bucket, or adding to one, they're going to take away from the other. So we've seen where premiums have increased, deductibles increased, co-pays have increased, and the big change that we've seen in the past year is ancillary benefits have gone down. So things like dental, vision, over-the-counter drug, or over-the-counter benefits, things like chiropractic care, things like that. So each plan has their own over-the-counter changes, but every year there's going to be more and more changes to that when that comes to Medicare Advantage plans. But we'll get into that a little bit. So who we are a local independent brokerage with offices in Daytona Beach. Our corporate office is Daytona Beach on Beach Street. Melbourne, Lake Mary, Orlando, Jacksonville, West Palm Beach, Bradenton, Savannah, Hilton Head, Charleston, Lakeland, Fort Walton Beach. We can add a few that we haven't added in there yet. Licensed in Florida, Georgia, South Carolina, North Carolina, Texas, Tennessee, Michigan, Alabama, Colorado, Montana. I think we're missing a couple there too. In fact, I know we are. We've got Virginia and I think Ohio, maybe another state or two. Our staff is licensed by insurance brokers with decades of combined experience. Specific there, brokers. Is everybody familiar with the term broker and an agent? Know the difference there? An agent works for one carrier. So let's say, I'm going to pick on a name. Let's say Humana. Humana hires agents. It's your job to sell Humana. That's it. We are brokers. We're licensed in multiple states, and we're appointed and contracted with every carrier. So we don't have any particular bias towards any particular plan. They all pay us roughly the same exact thing. So our objective is to find a plan that fits your needs, fits your budget. We want to make sure you're getting the drugs at the lowest possible cost, and we want to make sure that your doctors are in network, and make sure you're educated on your options before you make a selection. That's really where we specialize. Specialize in Medicare Advantage plans, Medicare supplements, and prescription drug plans. The reason why most of you are probably here is to learn what the difference is between a Medicare Advantage plan and a Medicare supplement plan. That is the most critical piece of information that you need to have when you're aging into Medicare, when you're starting Medicare. If you know the difference between those, the benefits, the pros and cons of each, it'll help you make a decision on what works best for you, your needs, and your budget. So we're gonna break down those differences while we're here today. This is our team. That photo was actually taken here last year, if I'm not mistaken. Team comprises of myself, Sean Brown. I am the agency principal. Joe DeSillis, who's currently at home. He is the agency general manager. Ernest Teisner, broker. Mark Ham, broker. Kimberly Penny up front. She's our office manager and everything at this point, basically. Douglas Horcher, who is our South Carolina agent. Michael Heimer out in the Orlando area. And Shauna back here in the corner. Shauna's multiple roles within the agency, but she's a licensed broker and acts as an assistant admin. She kind of does it all. All right, so let's talk about eligibility, original Medicare Parts A and B. Who has Medicare starting this year in 2025? Okay, so we've got 4 starting this year in 2025. So again, this is going to be specific to 2025 Medicare benefits. Most people have to sign up for Part A and or Part B if you are close to 65 and not receiving Social Security or railroad retirement benefits. You need to sign up at www.ssa.gov. Let me break that down. If you're receiving your Social Security benefits, you're automatically going to be enrolled in Medicare Part A and Part B. You don't have to do anything. It happens automatically. If you are not receiving Social Security benefits, you have to contact the Social Security office, whether you do that through ssa.gov and just apply online, or by calling the Social Security office and getting enrolled in Medicare Part B. For both Medicare Advantage plans and Medicare Supplement plans, you have to be enrolled in Medicare Part B. So many people might be under assumption, well, I can just have A, and then I'll purchase a supplement plan or an Advantage plan, and that'll cover me so I don't have to enroll in B. You have to have B to have medical benefits. It is for U.S. citizens and residents for at least 5 consecutive years, 65 years old, and worked for 40 quarters, which is basically 10 years. If you've got 10 years working experience paying taxes in the U.S., you are eligible for Medicare benefits. You may qualify if you are under 65 and have a disability and have been receiving Social Security disability benefits for 24 consecutive months. You have end-stage renal disease or ALS, also known as Lou Gehrig's disease. So we have clients that are 19, 18, 23 that have Medicare because they have been receiving disability benefits for 24 consecutive months. They're automatically enrolled in Medicare. So it's not exclusively for 65 and up. The initial enrollment period, when can I apply for Medicare? When can I first enroll? There is a 7-month initial enrollment period, the 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. So that's your time that you can enroll in Medicare. Part A enrollment, you are automatically entitled to Medicare Part A at age 65 if you have worked your 40 quarters or qualify through a spouse. Part A and B enrollments are automatic if you are receiving Social Security retirement benefits prior to age 65. If you are not receiving Social Security benefits, you need to apply for Parts A and B at ssa.gov. What if I'm late? Usually there's no penalties for Part A unless you didn't pay enough into Medicare or hadn't worked your full 40 quarters, 10 years. Part B, there is a late enrollment penalty if you do not sign up for Part B during that 7-month initial enrollment period. And that penalty, unless you qualify for a special election period, is 10% of the premium per year. So for example, the Medicare Part B standard premium this year in 2025 is $185. So if you opted not to sign up for Part B, you just took the risk and said, you know what, I'll get it next year, then if for every 12 months that you didn't sign up, there's going to be a penalty. In this case, it would be $18.50 for every month, forever. So it's not just a one-time thing. It's forever. So if you're starting at 67 and you live till 95, you're going to be paying that penalty every month until you're no longer with us. Part C, Medicare Advantage, and D, standalone prescription drug plans. If you don't sign up when you're initially eligible, you have to wait until the next annual enrollment period, AEP, annually October 15th through December 7th. So if you opt not to sign up, not only is there a penalty, but you may have to wait an extended period before you can sign up and then be without benefits for a significant period of time. So something you certainly don't want to do if you have the means to pay your Part B. There is a general enrollment period for Parts A and B for those that failed to enroll without other circumstances. That is January 1st through March 31st. So again, let's say you're eligible in February, but you opt not to wait, and then you want to sign up in July, but you're outside of your initial enrollment period. You've got to wait until the next calendar year to enroll. So don't delay if you do not have to. What if I work past age 65? That's obviously common now. It seems like most beneficiaries are working past age 65. So if you're working beyond age 65, you may enroll in Medicare Parts A and Part B. You certainly want to talk with your benefits administrator about what they have in place. So if you've got employer coverage, you want to make sure that employer coverage, if you opt to keep it, is what's called credible coverage. That way, when you leave the employer coverage down the road, you're not stuck with a late enrollment penalty. And the best way to know that is through your benefits administrator at your employer. You want to make sure to keep records of your group health insurance coverage with your employer. Reason for that, Let's say you work for a bank. We know how banks change hands pretty frequently. They sell to this bank, sell to that bank, sell to that bank. Well, if you go 10, 15 years working for the bank and then you want to sign up when you're 80 and your bank has changed hands 5 different times, well, you need to be able to prove to the Social Security Administration that you had coverage for all those years to avoid getting hit with a late enrollment penalty. We've seen that happen within our own agency. I believe one of our clients, she was 82, worked for a bank for those 17 years. She left the bank, but it changed hands 4 or 5 different times. She ended up having to track down, it took her quite a bit of time, she had to track down evidence that she had coverage for all that time in order to avoid that late enrollment penalty. At retirement, you are eligible for a special enrollment period, so then you don't have to wait until the next year to sign up, as we mentioned. So if you opt not to sign up for Part B when you turn 65 because you have employer coverage, and then when you're 67 you decide it's time to retire, you can enroll in Part B during your special enrollment period when you leave without a late enrollment penalty or anything like that. You get 8 months after employer-sponsored coverage ends to enroll in Medicare Part B without penalty. However, recommended to sign up before retirement to avoid any sort of lapse in coverage. So if you opt, you're going to retire on May 31st, you don't want to wait until June 1st to sign up because you would have to go until July 1st. So you could end up going a month or longer without coverage, something you don't want to see happen. So you want to have your ducks in a row before you actually retire. One really important thing to note is at the bottom, you see it allows 63 days after employer coverage ends to enroll in Medicare Part D without penalty. So this is a little confusing. B, it says you have 8 months. D, it says you only have 63 days. Don't wait 8 months. Make sure to sign up within that 63 days and you avoid a penalty in both, either Part B, which is medical insurance, or Part D, which is drug. That's always the easy way to remember that. D is for drugs. This is the income-related monthly adjustment amount for Medicare Parts B and D. So as mentioned, if you look at the top line under total Part B premium monthly, the typical Medicare Part B premium is $185. And that's for a single person making less than $106,000, or a married couple filing joint making less than $212,000. And that's on a 2-year look back. So it's going to be looking at, for example, if you are signing up this year, they're going to look at your 2023 earnings to determine what you're going to pay for your Medicare Part B. So this chart is going to show you, let's use for an example, let's say you're a married couple and in 2023 you made $350,000. Well, if that were the case, your monthly premium is actually $480.90, not $185. So that's really important to know before you retire or before you sign up for coverage, that you know what Social Security is going to charge you for your Medicare Part B. You'll see here on Part D coverage, there is no additional charge for Part D in the top bracket, married couple making under $212, but if you're between $500,000 and $750,000 or more, you could end up paying an additional $85.80 per month for drug coverage when you go to sign up. So this is really important, just so there's no surprises when it is time to sign up for Medicare, and then you can adjust your budgets accordingly. Coverage options include Medicare Part A, Part B, Part C, and Part D, and Medicare Supplement. We're going to discuss all of those while you are here, get you familiar with them, and really explain the differences, most importantly, between Part C and Medicare Supplement. Original Medicare, that is the red, white, and blue Medicare card that pretty much everybody is familiar with seeing. Part A is hospital benefits. Part B is pretty much anything outside of the hospital with a little bit of gray area in between. Part A, hospital visits, inpatient hospital care, skilled nursing facility care, hospice care, home health care. All that's covered in the Part A umbrella, which you are entitled to. Typically, you pay $0 a month for Part A, and those benefits come with that. Let's talk about Part A facts. Most people don't pay a monthly premium. You only pay your deductible for a hospital stay of fewer than 60 days, which is $1,676. I want to slow down back up to that a little bit. So any hospital stay of less than 60 days, so even if it's one day, if you only have original Medicare, you don't have a Medicare Advantage plan, you don't have a Medicare supplement plan, if you had to go to the hospital and you're there for a day, 2 days, 5 days, or 59 days, you pay a flat $1,676 per stay. So if you had a bad year, you went to the hospital 3 different times, you'd be paying that $1,676 3 times. So that's why most people don't just keep original Medicare, because it's too financially risky. If you have multiple hospital stays, that can get very, very expensive. You can't be turned down because of your medical history or pre-existing conditions. So that's great. So if you've got some concerns about your health and you're aging into Medicare and you're afraid you may not be covered, you don't need to worry about that when you're first signing up for Medicare. You will be approved for your Medicare coverage regardless of your medical history. Stays of more than 60 days require a daily copayment of $419 per day, days 61 through 90. If you're in the hospital longer than 91 days, there's a daily copay of $838 per day. So again, that's why most people just do not keep original Medicare, because it's too financially risky. Can you imagine that situation? You're at Mayo Clinic, you're there for 6 months, and then you end up getting handed a bill for hundreds of thousands of dollars. That would be the case if you only have original Medicare. And there's no max out of pocket. So if you accumulated $2 million worth of medical bills and you don't have an Advantage plan to protect you, you don't have a supplement plan, you're going to be responsible for that amount. Multiple stays mean multiple deductibles, as mentioned. You can go to any qualified hospital in the United States that accepts new Medicare patients. Fortunately, I am not familiar with a hospital that doesn't take Medicare benefits. So as long as you have Medicare Part A and Part B, you can go anywhere, any hospital, anywhere in the country that takes Medicare, which I'm pretty sure is all of them. That does change, though, if you have a Medicare Advantage plan, and we'll get more specific on that. Hospital care outside of the U.S. isn't usually covered. There's some benefits. There's very little benefits. If you have Medicare and you travel internationally, you do not want to rely on just Medicare. Even if you have a Medicare Advantage plan, even if you have a Medicare supplement plan, do not rely on just Medicare. If you're going to be making a trip, let's say you're going to Peru, you're going to be there for a month, you can get a month worth of international global coverage through us, through AAA, you can go to IMG Global, you can go, there's a bunch of different ways that you can do it, but you only have to pay for the time that you're away. So, you don't have to buy a year worth of coverage when you're only traveling for a couple of weeks or a few weeks. And it's really inexpensive. Just something very important to remember before you do travel. Part B, doctor and outpatient visits. Services from doctors and other healthcare providers, both in and out of the hospital. That's why I said there's some gray area there. Even if you're in the hospital, your Part B could be charged, depending on the doctor and what they're doing. Outpatient care, surgery, ambulance, outpatient mental health, laboratory services, durable medical equipment like wheelchairs and oxygen tanks, things like that, diabetic monitoring supplies, things like that. Outpatient physical, occupational, and speech therapy is covered. Some preventative care is covered by Part B. So again, easiest way to remember that, hospital is Part A, outside of the hospital is Part B, little gray area in between. 2025 cost, the Part B deductible for 2025, and this is an annual deductible, you only pay once, and this is separate from the Part A deductible. The Part B deductible is $257. Pretty reasonable. For coinsurance, you pay 20% of Medicare approved cost above that $257. So, not to be scary, but again, mention the Mayo Clinic analogy. You're there for 6 months, you get a bill for $500,000. Well, you're going to be responsible for 20% of that if you don't have an Advantage plan or you don't have a supplement plan, which $500,000, 20%, that's $100,000. and there's no maximum out of pocket. Part B has a monthly premium that is determined based on your income, which is typically $185. In that prior chart we saw, depending on your income, it could be more. You may have a penalty and higher premiums if you join after your initial enrollment period, and you must wait for the next general enrollment period. I love this chart. I found this years ago. I use this chart in every Medicare presentation I have with somebody that's aging in. When you really break it down, there's really only 3 options when it comes to starting Medicare. Hundreds of plans, but there's really only 3 pathways. The first pathway is having original Medicare, that red, white, and blue card, and then you have the option to join a Part D plan. With the Part A, as mentioned, you have $1,676 deductible for hospitalizations per incident. Part B, you have a deductible of $257, annual deductible, and then you pay 20% in addition to that. Again, very risky. Most people aren't going to do that if they're educated on what their options are, just too financially risky. Drug plan, you can add it, you can opt not to add it, but if you don't add it and you want to sign up for it later, there's a late enrollment penalty. Original Medicare, I want to highlight this. With Original Medicare, you can go to any doctor, any specialist, any facility, or any hospital anywhere in the country. So if you have that red, white, and blue card, and just that red, white, and blue card, anywhere that accepts Medicare you can go. There's no networks, nothing like that. So if you want to go to Mayo Clinic will accept you. The second option is a Medicare supplement plus a drug plan. So you'll notice this looks very similar. You have Part A and Part B, which that means when you have a Medicare supplement, you can still go any doctor, specialist, facility, or hospital anywhere in the country when you have a Medicare supplement plan. So the Part A, we talked about the deductible there. Part B, we talked about the deductible there, plus the 20%. What the Medicare supplement does, you still have original Medicare, but the Medicare supplement plan picks up what Medicare doesn't pay. So for example, that 20% Medicare supplement plan would typically pick up that 20%. Plus it would pick up the hospital deductible, and it really depends on which one you have, and we'll get in more detail with that. So if you're looking for the best access to care, that's a Medicare supplement plan. Go anywhere you want, including Mayo Clinic. Option 3, Medicare Advantage prescription drug plans. So this is different than Medicare supplement. Medicare supplement, you typically have a monthly premium in addition to your Medicare Part B. So you pay your $185 there, pick up a Medicare supplement plan. I'll just make up a number. Let's say it's $200 a month for a supplement plan. Well, with an Advantage plan, you still pay your $185 Part B premium, but typically Medicare Advantage plans have a $0 initial, a $0 additional premium. So you pay your $185, and then for your Advantage plan, you pay $0 for that. The difference is, with a Medicare Advantage plan, there are networks. There's HMOs and there's PPOs. I'm assuming everybody's pretty familiar with the difference between those. Okay, so Medicare Advantage plans are a lot like what you're used to over the past however long. When you sign up for an insurance plan, it's either an HMO or a PPO. You can go to doctors within the network. If it's a PPO, maybe you can go out of the network, but it's really up to the doctor if they decide they want to take your plan out of network or not. That's how an Advantage plan works. So you pay $0 per month. You may have a medical deductible, you may have a drug deductible, and then you pay co-pays whenever you use the plan. So it's kind of more as a pay-as-you-go type setup, while a supplement, you're really paying up front. That's how that works. Advantage plans, again, have a doctor network, you pay co-pays, but you have limited access in some cases to where you want to go. So for example, Jacksonville Mayo Clinic does not take Medicare Advantage plans at all. So if going to Mayo Clinic or other specialty hospitals is important to you, and you have the budget for a supplement, a Medicare Advantage plan may not be the right fit for you. So that might be the most important thing that I say today, is if access to care is number one to you, if that's the most important thing to you, you really need to be highlighting Medicare supplement plans. If access to care, like you're okay with choosing from a doctor's network, you're okay with referrals, but you want to pay $0 per month to keep a little in your pocket month over month, an Advantage plan may work there. And Medicare Advantage plans, they have a maximum out of pocket. Usually ranges maybe $3,500 to $9,000 for the year. So if you have a really bad year, you're not going to pay more out of pocket than that annual max out of pocket. Advantage plans, unlike supplement plans, pretty much all of them are going to have some ancillary benefits included. Dental, vision, over-the-counter benefits, chiropractic services, things like that. Supplement plans, pretty much you're paying the monthly premium and you get your medical covered, but typically no ancillary benefits are covered. So if you wanted to add dental, you got to add a dental plan to that, while an Advantage plan is going to give you some dental benefits with it. Let's talk about Medicare Advantage plans, and you'll notice here it says Part C. Those are the same thing. Two names, exact same thing. So just so there's no confusion there. If you see Part C, that means Advantage plan. If you see Advantage plan, that means Part C. One and the same. With Medicare Advantage plans, it covers Part A and Part B benefits, just like if you had original Medicare. In most cases, it includes drug coverage with it. So Part C, they're sort of known as an all-in-one plan. One card covers your hospital stays, covers your doctor visits, and it covers things like outpatient procedures, and it covers drugs, all in one card. Often, offered by private insurance companies. There are many different carriers and many different plan options. So just to give an example, if you were to go on Medicare.gov, you're going to go shop around for a Medicare Advantage plan yourself, you'll notice there's probably, I don't know this year, maybe 60 to 80 plans available. There's a ton of options, and that can be really hard to navigate. But it does give you the opportunity, you can type in your prescription drugs. If you go to each individual insurance plan's provider networks, you can see if your doctors are in network and things like that. That's something that we do for you as a broker. So if you ever came to us for no fee, you say, hey, Sean, we're starting Medicare. Here's our doctors, here's our prescription drugs. Can you help us find a plan that we can make sure we go to our doctors and get the drugs at the lowest cost? That's what we do for you. Often includes additional benefits like eye care, hearing, dental, wellness services, nurse advice, phone line support, gym memberships, over-the-counter benefits, things like that. So that's one thing that Medicare Advantage does, different than Medicare Supplement. They'll entice you in by adding these extra little benefits that you can take advantage of. You must be enrolled in Medicare Part A and Part B to have an Advantage plan. You must live in the plan service area. And Medicare Advantage plans do not have underwriting, nor do they have medical questions. So what that means is when you sign up for a Medicare Advantage plan, as long as you're doing it during a qualified time period, like the annual election period or your initial enrollment period, there's no medical questions, you are approved. Nothing you need to worry about there. Must live in the plan service area. That's an important note because let's say you have a friend that lives in Tampa. They have a plan, they really love it, and they tell you, oh, you totally need to sign up for this plan, but you live here. Those are two different service areas. There might be a plan very similar to what they have in Tampa, but it's not going to be the identical plan. So you've got to be shopping within your area. That's why if you've ever seen the commercials that are advertising Medicare Advantage plans, they always mention your zip code. Type in your zip code. Well, that's important because they need to know what plans are actually available in your area. Costs. Plan premiums and terms can change from year to year. Plan can be canceled at the option of the insurer. Most Medicare Advantage plans are going to have a $0 premium, but that can change. That can change year over year. So even if you enroll an Advantage plan this year and it has a $0 premium, and you like the co-pays and you like the doctor network and all those things, well, the very next year, all that could change. They could add a premium, they could add a deductible, they could take doctors out, they could take prescriptions out, things like that. So if you have an Advantage plan, you really need to shop every single year to make sure that the plan that you selected for the year prior is still good for you the next year. And again, that's something we do for our clients. Each year in September, we reach out to all of our clients and say, hey, new year is coming. Bunch of plan changes are coming. Send us your doctors, send us your medications. We're going to take a look at the plan you have. We're going to see if we can find you something that is going to fit you just as well next year as it did this year. And if not, we're going to explain what changes we need to make or help you along the way so you don't get overwhelmed with that 60 to 80 plan options that are out there. Most plans in our area have $0 additional premium cost other than Part B, which is $185 per month, and then the Advantage plan is typically $0. Some plans, known as givebacks, actually pay down your monthly Part B premium by up to $174.70. These are super popular now. So if you are signed up for Medicare Part B and you're paying $185 and that comes out of your Social Security check, or you're writing them a check, however you do that, you can enroll in a Medicare Advantage plan that will pay almost all of your Medicare Part B premium for you. I can't get specific in what plans. This is an educational event, not a sales event, so I can't get specific, but that is something that you definitely want to inquire about, what give-back plans are available. There's one in this county that is ultra popular because instead of paying $185 a month, you'll actually be paying $10.30 a month for Part B, which clearly would be very, very nice. Okay, with Medicare Advantage plans, they come in the form of HMOs, health maintenance organizations, I'm sure everybody's heard of those, preferred provider organization, PPOs, special needs plans, like dual eligible or chronic condition plans. Dual eligible means that you have Medicare and Medicaid. So if anybody in this room has Medicare and Medicaid, you are going to be eligible to receive extra benefits that somebody without Medicaid is able to receive. So that is something that's always a good idea to at least apply for Medicaid. If you get approved, it opens up this whole other world of plan options that they're really quite spectacular, but not everybody can get them. Chronic condition plans, let's say, for example, you're diabetic or you have COPD, some sort of chronic condition. If your doctor can verify that you do have that chronic condition, there are plans specific to your needs that can be really helpful. Other plans, there's none locally, none in Florida I'm even aware of. PFFS plans, private fee-for-service plans, MSA plans, and HMO point-of-service plans. There is one HMO point-of-service plan locally. I'm not going to get in the weeds on that. It's a little misleading the way that the plan advertises themselves. They say they're an HMO point-of-service plan, but the point-of-service plan, a portion of it only actually applies to the dental. So that one's a little confusing. So I won't get too into that. I won't get too into any of the PFFS or medical savings accounts because they're just not even in our area anyway. All right, prescription drug plan facts. Okay, this is a big change this year from prior years. There typically was 4 stages to prescription drug coverage. One of the stages has been eliminated. That is the donut hole. Has anybody ever heard of the donut hole with drug plans? That used to be the big scary thing, but now that's been eliminated. So if you're taking expensive medications in the past, it would be covered during the initial coverage stage where you would just pay a copay or certain co-insurance, and then once you hit the donut hole, suddenly your costs for your medications would skyrocket until you reached a catastrophic phase and then it would go back down. Well, that donut hole has now been eliminated. So that takes all the fear out of that. So if you ever hear the term donut hole, it's gone. You don't have to worry about it anymore. So the 3 current stages for Medicare prescription drug coverage is the annual deductible stage where you, the member, pay 100%. Many plans have a $0 deductible. Many plans have up to a $590 deductible. Again, that's really why it's important to shop your plans every year, either independently or through a broker, to make sure that your medications aren't going to end up costing you an arm and a leg because you have a big deductible you have to deal with. You pay for the cost of your drugs until you reach the plan deductible amount. Some plans have lower deductible or no deductible. If your plan does not have a deductible, your coverage starts with the initial coverage stage. Initial coverage stage, there is a $2,000 annual max out of pocket. We talked about that earlier. That's helping some, not helping most, unfortunately, at this time. Member pays 25%, plan pays 65%, MSG pays 10%. You pay a copay or co-insurance. So for example, if you're taking a generic medication and you're in the initial coverage stage, you probably pay $0 for that drug, maybe $1, maybe $2, maybe $5, depends on the plan. The plan and the MFG pay the rest. You stay in this stage until total out-of-pocket costs reach $2,000, which includes costs paid in the deductible stage. So that's actually a combination of what you pay out of pocket and what the insurance company pays out of pocket. So that $2,000 cap might actually only be $1,300 out of your pocket or less, actually. Then there's the catastrophic phase. So if you've hit $2,000, at that point, you pay zero. Once you're in, your TROOP is what it's called, true out-of-pocket cost. Once you hit that $2,000, everything is paid 100%, as long as it's a covered a Medicare covered drug. Prescription drug plan Part D facts. So a drug plan you can get with a Medicare Advantage plan where it's built in, or you can just purchase a drug plan by itself, a standalone drug plan. Coverage is not automatic. It's something you do need to sign up for. Penalties may apply if you enroll too late, and there's a 1% of the average premium per month for each month that you did not have credible drug coverage. So the 2025 average premium is $46.50. So let's say you go 10 months without coverage, and then you sign up for a drug plan and you're paying a late enrollment penalty. Well, 1% of $46.50. That's roughly 46 cents. Not too bad, but you would pay that penalty every month forever. It's not a one-time thing. It's not a one-year thing. As long as you're in a drug plan, you're going to have to pay that penalty. Another reason why it's really important to sign up right when you're eligible. Each plan has a formulary of drugs that is covered. Make sure your prescriptions are covered before you enroll in a plan. Again, you can self-shop that. You can go through a broker, but that's really important. You want to make sure that your medications are covered and are you getting them at the best possible cost. Usually a plan changes its formulary cost and tiers each year. It is very important to check annually. Very important. So as I mentioned, we reach out to our clients every year in September. They send us our medications. We shop their drug plans for them and tell them, hey, you go with this plan, this is what you're going to pay the least amount of money out of pocket for. In some cases, we've seen where that could save hundreds or thousands of dollars for clients. So it's really important to shop that. More often than not, it ends up being the same plan you're already in, but at least you know for certainty, okay, we're good to go with this plan. We did our homework. A Part D formulary. Each Part D provider has a formulary. This is a list of drugs that the insurance plan covers. Many drug plans have a tiered formulary. That means the plan divides drugs into groups called tiers. Generally, the lower the tier, the lower the copay. So things like preferred generics, they're usually in your tier 1 category. That's where you pay the least amount for a drug. More often than not, usually zero, maybe $1. Tier 2, those are non-preferred generics, typically. Tier 3, preferred brand name drugs. Tier 4, non-preferred brand name drugs. And Tier 5 are specialty drugs. That can be things like cancer, Humira and certain cancer drugs, things like that. Very expensive drugs fit in that Tier 5 category. And you'll notice each next to the tier, we have the dollar sign indicator telling you how much more they're going to cost in general based on the tier of the drug. And that's another reason why it's really important to shop. With one plan, your medication might be Tier 1, while with another plan, it might be Tier 3, making a very big cost difference there. So really important to shop. Okay, discussing Medicare supplement plans. Again, Medicare supplement, very different than Medicare Advantage. Medicare supplement, any doctor, any specialist, any facility, any hospital, anywhere in the United States, as long as they take Medicare. It helps to cover what Medicare Parts A and Part B do not cover, such as portions of coinsurance, co-payments, and deductibles. Also offered by private insurance companies, there's a bunch of different plans. Plan A, B, C, D, F, G, K, L, M, N. That's a lot. And there's also something called HDF or HDG, High Deductible Plan F, High Deductible Plan G. So that's something the broker can help you out with to help you determine what one of those plans is going to fit you best. The most popular by far is Medicare Supplement Plan G. Medicare Supplement Plan G is very easy to understand. You go anywhere you want, And the only thing you are responsible for out of pocket is the Part B deductible, which was $257. So, Mayo Clinic analogy, you have a Plan G, you go to Mayo Clinic, they will accept you because you have original Medicare. If you get $1 million worth of medical bills, you would owe $257. That's it. So that's how simple a Medicare supplement Plan G is to understand. Go anywhere you want, you will not pay more than $257 out of your own pocket. There's going to be a monthly premium for that, though. Typically, that's going to range somewhere between $170 and maybe up to $300, depending on your age, where you live, male or female, smoker, non-smoker, things like that. Generally, the more comprehensive the coverage, the higher the premium. Naturally, if the more it's going to cover, the higher your monthly premium it's going to be. The less it's going to cover, the lower your monthly premium is going to be. A good example of that is a high deductible Plan G. We talked about Plan G. Might pay, I'm going to make up a number, $200 a month, and then you pay the deductible at $257. Everything's covered after that. Well, with a high deductible G, same scenario. You pay a monthly premium, you pay the deductible, but then there's a high deductible that comes along with that. I don't know the number off the top of my head. Somewhere around $2,400 is the high deductible portion of it. But your premium might only be $60 or $70 a month versus $200 a month. So that's an opportunity to pay less per month, still be able to go anywhere you want. You just have a higher deductible if you need to utilize your benefits. Regulated and standardized by federal and state laws. The reason why that's important, we mentioned a Plan G. A Plan G or a Plan K or L or whatever, they're all exactly the same from one carrier to another, whether you have a Humana, United, Florida Blue, etc. They're exactly the same in terms of the coverage. The only thing that changes is the monthly premium. So you want to make sure that, okay, if I'm going to sign up for a Plan G, I want to get it at the lowest possible cost. So if one plan's offering it for $160 a month, but another plan's offering it for $250 a month, and it's identical coverage, well, naturally you're going to want to go with the lower premium. But you want to keep in mind that you're going to want to go with a financially stable company. A company that, A, are they going to be able to pay your claims when you need them to? That's what we can help you with. Make sure you get with a company you can feel confident in. And also that's going to have stable rate increases year over year. Some Medicare supplement plans will have rate increases that are nominal year over year, maybe average 2.5%, kind of goes with inflation. However, some are going to look like this. Every year they have these big rate increases and decreases. You could end up seeing a 20% increase if you go with a plan that just doesn't have the kind of stability that you need. So that's something really important. That's a good reason why I suggest using a broker when shopping. Helps with some of out-of-pocket costs not paid by Medicare. Premiums vary based on the plan and the insurance carrier. So even though it's identical coverage, the plan premium can certainly change. Guaranteed issue for Medicare supplement begins the first day of the month you are enrolled in Medicare Part B, and in most states lasts for 6 months. Very important to note. If it's in the budget to purchase a Medicare supplement when you're first eligible for Medicare, I strongly advise that you do because you're guaranteed issue. Your medical history does not matter. You could be stage 4 cancer, going through it right then and there, and you will be approved. However, if you apply after 6 months of when you first turned 65 or start your Part B, then there's medical underwriting, kind of like life insurance. If the insurance company doesn't like your medical history at that point, they will decline you, and you may never have that opportunity to get in. So right when you're eligible for Medicare, if it's in your budget, I strongly recommend going with a supplement plan, because you can always, down the road, if the premium no longer fits your budget, let's say 3 years, if it works now, but 3 years from now it doesn't work anymore. Budgets change all the time. So if that were the case, you can leave a supplement plan and enroll in an Advantage plan with no medical underwriting. But it doesn't work the other way. Does that make sense to everyone? Okay, so if it's in your budget, when you first turn 65 to get a supplement, I advise that you do, because you have the safety net there with Medicare Advantage. The other way may not work out so well. The most difficult phone call that we get, and we get it pretty frequently, we'll get somebody that's had Medicare Advantage for a couple of years, 5 years, 10 years. They get the They get the cancer diagnosis, they contact Mayo Clinic, and they say, hey, I want to get in to see your wonderful doctors there in your wonderful facility. Well, Mayo Clinic is going to say, great, what insurance do you have? Well, I have a Medicare Advantage plan. Well, I'm sorry, we're not accepting Medicare Advantage patients. So what happens at that point? They get on Google or they ask a friend, they call me, they call our office, and they say, hey, I found out I'm sick, I've got a Medicare Advantage plan. Mayo Clinic told me I need to sign up for a Medicare supplement plan. I have to be the one to tell them, it's too late, you're sick. They're not going to take you. Best analogy I have for that is you can't wreck the car and then call Geico. So you need to have the coverage, the supplement plan, before you need it. Because if you go to sign up for it later, someone like me has to give you the bad news. And that's a tough phone call. We get it pretty frequently. So avoid that if you can. Let's see. Coverage can be denied based upon medical questions at older ages. Goes with you anywhere in the United States. Again, this is Medicare supplement. There's no network, so if you wanted to go to a doctor in Spokane, Washington, off you go. The insurance company is not going to tell you cannot do that. As long as that doctor accepts Medicare and they're willing to accept you as a new patient, you can go. It is guaranteed to continue as long as you pay your monthly premium on time and have not made any material misrepresentations on the application for insurance. When can I enroll? In most states, there is a 6-month guaranteed issue window, which starts when you turn 65 or enroll in Part B. What if I'm late? You can apply later, but may be charged a higher premium due to age or existing health problems, or rejected entirely depending on your health history. I've done this for 11 years. I've written well over 1,000 Medicare supplement plans. I have never seen the top part, where you're charged a higher premium because you're sick. I don't know if that just doesn't exist or doesn't exist in this state or the states that I'm licensed in. I've only seen approved or denied. That's it. And if you've got any chronic health issues or recent hospitalizations, you're likely to be declined. Here is a standardized Medicare supplement policies chart. Okay, there it is. $2,870 is the high deductible this year. So this chart shows you what plan covers. So there's A, B, C, D, E, F, H, D, F, G, H, D, G, K, L, M, N. I mentioned G being the most popular because it covers everything except for the Part B deductible of $257. Now you see there's one other plan that covers that, which is the Plan F, but you would have to have turned 65 prior to January 1st of 2020 to be eligible for a Plan F. If you turn 65 after that date, you can no longer get an F. But you can get a G, which a G is usually going to save you on monthly premium compared to an F, and the only difference is you're responsible for the $257 deductible. That's it, just the $257 deductible, and everything else is covered. Oh, yeah. Everybody getting spam calls? I just kind of threw this in here. If you'd like, and it should be in your packet, this is how you can help avoid some of those spam calls. It's not going to stop them all. But if it can cut them in half, I encourage you to do that. You can call the 888 number there, and I believe you can also do it online. Try to help some of those spam calls, because I know they're pretty ridiculous.